A stroke occurs when blood flow to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. This can lead to permanent brain damage and even death. The faster a stroke is treated, the less likely it is to cause lasting damage. However, the tricky part is that strokes can sometimes strike silently, with symptoms that are subtle or easily dismissed. This article explores 11 early warning signs of stroke, silent screams from your body that shouldn't be ignored. By recognizing these signs and acting quickly, you can significantly increase your chances of a full recovery. Remember, in case of a suspected stroke, time is brain. Call emergency services immediately. 1. Facial drooping. One of the most recognizable signs of stroke is facial drooping on one side. This asymmetry can manifest as a drooping eyelid, a lopsided smile, or difficulty raising one eyebrow. Ask the person to smile and observe if one side of their face appears uneven. 2. Arm weakness or numbness. Sudden weakness or numbness in an arm or leg, especially on one side of the body, can be a sign of stroke. This weakness can make it difficult to raise an arm, grip an object, or walk normally. Ask the person to raise both arms and observe if one arm drifts downward or appears weaker. 3. Speech difficulties. Slurred speech, difficulty forming words, or difficulty understanding what others are saying can all be indicators of a stroke. The person might struggle to speak clearly, mumble their words, or seem confused when spoken to. 4. Sudden vision changes. Sudden blurred vision, loss of vision in one or both eyes, or double vision can all be signs of stroke. The person might report difficulty seeing clearly, experiencing a sudden loss of vision in one eye, or seeing double. 5. Sudden dizziness, loss of balance, or coordination problems. Sudden dizziness, loss of balance, or difficulty walking can be stroke symptoms. The person might feel unsteady on their feet, have trouble walking in a straight line, or experience a sudden spinning sensation. 6. Severe headache. A sudden, severe headache that comes on quickly, often described as the worst headache of their life, can be a sign of stroke. This headache might be accompanied by nausea, vomiting, or confusion. 7. Sudden nausea, vomiting, or fever. While nausea, vomiting, and fever can be caused by various illnesses, their sudden onset alongside other stroke symptoms should raise a red flag. These symptoms, combined with the signs mentioned above, warrant immediate medical attention. 8. Difficulty speaking or understanding language. A stroke can affect areas of the brain responsible for language processing. The person might experience difficulty finding the right words, struggle to understand what you're saying, or become confused during conversation. 9. Confusion or difficulty thinking. Sudden confusion, disorientation, or difficulty understanding simple instructions can be signs of stroke. The person might seem disoriented, have trouble following directions, or appear confused about their surroundings. 10. Personality changes. A sudden change in personality can be a warning sign of stroke. The person might become agitated, withdrawn, or exhibit uncharacteristic behaviors. Family members and close friends who notice these sudden personality changes should be particularly attentive. 11. Transient ischemic attack, TIA. Sometimes, a stroke can be preceded by a mini-stroke called a transient ischemic attack, TIA. Symptoms of a TIA are similar to those of a stroke, but they typically last for a short period, minutes to hours, and resolve completely. While a TIA itself might not cause permanent damage, it's a strong warning sign that a full-blown stroke could be imminent. Remember, the presence of one or two of these signs might not necessarily indicate a stroke. However, if you experience several of these signs for an extended period, or if you suspect someone is having a stroke, call emergency services immediately. Early diagnosis and treatment are crucial for minimizing brain damage and improving the chances of a full recovery.